Mrs. Baker. How are ya?
Good. How are you?
Good. Now that I've got you sitting up in the chair, can I go ahead and brush your hair out?
That'd be great. Thank you.
All right.
To perform hair care for any patient, begin by performing hand hygiene and providing privacy. Determine if there are any contraindications to the procedure. Ask the patient if she has any preferences in hair care products and if she likes to have her hair combed or styled in a particular way. Encourage her to let you know if she feels uncomfortable at any time.
Once in a while.
Sounds good.
Okay.
Can you go ahead and take your glasses off for me
Sure.
and set them on the table?
Thanks.
Apply clean gloves and place a towel over the patient's shoulders or under her head if she's in bed. Use a comb to part the patient's hair into 2 sections and then into 2 more sections. Inspect the condition of the patient's hair and scalp. Be sure to dampen the hair lightly with water, conditioner, or an alcohol-free detangling product before combing it. Move your fingers through the hair to loosen any large tangles. Using a comb, start on either side of the head and comb from the scalp toward the ends of the hair. Continue until you've combed through all of the patient's hair. Finish by combing it into place to shape and style it.
Here's your glasses, Mrs. Baker.
Great. Thank you.
To shampoo a bed-bound patient's hair, first, check to see if a healthcare provider's order is required and to be sure there are no contraindications in positioning the patient.
Can you please state your name for me
Glenn Royce,
and your date of birth?
10/23/62.
Good. Looks like we've got orders to shampoo your hair. I'm going to go grab the supplies, okay?
Sounds great.
I'll be right back. All right, Mr. Royce, I've got the supplies I need to wash your hair.
Okay.
I'm going to go ahead and help you turn onto your back in the bed. I know you're kind of sore, so just take it slow, and I'll help you get over.
Apply clean gloves and inspect the hair and scalp for abrasions, lacerations, inflammation, and infestation, and determine if the patient needs any special treatments, such as a shampoo for dandruff, lice, or removal of matted blood. Put on a disposable gown in addition to wearing gloves if lice are present. Make sure your patient is supine with his head and shoulders at the top edge of the bed.
Let me know if you're uncomfortable at all.
Place a waterproof pad under his shoulders, neck, and head.
And I'm going to help you get your neck up here.
Slide the shampoo board under his head and a wash basin under the trough spout. Be sure the spout extends beyond the edge of the mattress.
All right.
Place a rolled towel under the patient's neck
Like, place it back down.
and a towel over his shoulders.
There you go. Okay, I'm going to go ahead and arrange this towel over your shoulders so you don't get wet while we shampoo your hair.
Okay.
Comb his hair to remove
I'm
tangles.
going to go ahead and comb through your hair before we get started with washing it.
Place a towel or washcloth over his eyes. If the patient wishes, he can hold it in place. Slowly pour the water from the pitcher or graduated cylinder over his hair until it's completely wet. If you notice any matted blood, use hydrogen peroxide to dissolve the clots and then rinse with saline, but be careful doing so near open wounds. Then apply a little shampoo. Work up a lather using both of your hands. Begin at the hairline and work toward the nape of the neck. Then shampoo the sides of the head and massage the scalp by applying pressure with your fingertips. Be sure to lift your patient's head slightly with one hand to wash the back of his head.
Now I'm just going to rinse your hair off, okay?
Rinse the hair with water from the pitcher or graduated cylinder. Make sure the water drains into the basin and keep rinsing until the hair is free of soap.
All right, I'm going to dry your hair off for you, okay?
Okay.
Wrap the patient's hair in a towel. Dry his face with the cloth he used earlier to protect his eyes. And dry off his neck and shoulders if necessary.
And get the back of your neck. Now I'm going to go ahead and take away the shampoo board, okay?
Okay.
Finally, dry his hair and scalp with the towel. Use 2 if the first becomes saturated. Then comb the patient's hair to remove any tangles. If the patient wants any leave-in conditioner or oil, apply it
The
now.
back.
If her hair is coarse or curly, condition it after you wash it. Using a wide-tooth comb, begin at the nape of the neck and comb small subsections of the hair, starting at the ends. Continue until the hair is tangle-free. Assist the patient in finding a comfortable position. Put the side rails up and the bed in the lowest position. Dispose of any used items and store your reusable supplies. Remove your gloves and perform hand hygiene. Document shampooing if your agency requires it.
All right, Mrs. Callahan, I'm going to go ahead and wash your hair for you. Are you comfortable in the chair?
I am. Thank you.
Great.
You might need to shampoo a patient's hair using a disposable shampoo cap. Help the patient into a comfortable position. She can sit in a chair or upright in the bed. Apply gloves and comb her hair to remove any tangles or debris.
Great. I'm going to go ahead and comb through.
Okay.
Just kind of check out your scalp before I wash it.
Preheat the shampoo cap per the manufacturer's instructions. Then open the package and put the cap on the patient's head. Be sure to tuck all of her hair beneath it.
We just got to make sure we get all your hair in this cap.
Okay.
Just gonna tuck it all in there.
Check the fit and then massage her head through the cap. Keep massaging for 2 to 4 minutes, according to the package directions. You might need additional time if the patient has longer hair or if her hair is matted with blood. When you've finished, take off the cap and discard it in the trash. Do not dispose of it in the toilet. Ask the patient if she'd like to have her hair dried. If so, dry it with a towel or dryer. Then brush or comb it as the patient prefers. Dispose of the used towels, remove your gloves, and perform hand hygiene.